AristaCare Indian Nursing Home provides post-acute inpatient rehabilitation, memory care, and long-term care services. Watch the highlights from my conversation with Mukund Thakur, President at Indian Nursing Home Program, Jocelyn Delgado, Director of Business Development, and Robert Greenberger, Executive Director of AristaCare Health Services.
In my experience, I find out that the people, older people, need comfort, culture, and care. The people come to the nursing home for better life, but because of the language, because of the food, because of the environment, because of the language, they are not really comfort over there, and they come for the really better life. But because of all these things, they are not really happy over there. So it was in my mind, let's do something for the community really need. And I hold the program, Indian Nursing Home Program, and I create the whole Indian environment. I put all the decor and temples and Indian nurse, Indian doctor, Indian food. And we started this program in 2005, and the community liked this program so much. And within less than a year, we have almost like a 52 residents. And then later on, I have continuously people calling me for the Indian program.
We want our better care model includes the concept of we have telemedicine. So we can bring a piece of equipment into the room. You, just like in Star Trek, one of my favorite shows, you beam up Scotty, you beam up the doctor, and the doctor will be able to, literally, because of the technology, be able to have a stethoscope, otoscope, and hear them even better than they were. And actually, it's interesting because this idea came up years ago. I was chatting with a physician that does work in India, and he was telling us how they set up, because they have certain rural areas that they cannot have physicians, they set up these makeshift, these little places where physicians can see remotely. And I said, if they could do that in a village in India, why can't I do it by us in America?
So we were fortunate enough to have the top leadership that helped guide us through COVID. I personally was working in a building at the time. It was tough on everyone. It was tough on the residents, the families, the staff. It was especially hard for our residents who couldn't see their families. That closed door, you can no longer come in and see your loved one, because we have to make sure they remain safe and they don't get sick, because back then, you got COVID, you got really sick. Now we're fortunate to have these vaccines that help us. But we had that closed door policy, so it was especially very difficult for our residents to not see their loved ones and the families. Now with the staff, it was also difficult because, like we've said multiple times, the staff feel like these people are their family members. Mm-hmm. So when they saw some of these people get very sick, and some of them unfortunately pass away, it really hit them so hard. And so we had to rally behind our team to, help them rally behind our residents, and provide that support from the top to really make sure that everyone felt like they were supported, and, that translated to the residents. The residents weren't able to come out to activities because, again, we wanted to keep them safe and separate. Mm-hmm. So we brought activities to them in their room as much as possible. We started using FaceTime and Zoom and so on and so forth to connect them with those family members. We were going in constantly to see these residents, whether they had COVID, whether they didn't have COVID. We PP'd up and made sure that they had FaceTime with people, and that they didn't feel so isolated. So of course there was that isolation, because there was that forced isolation, but we tried to mitigate that as much as possible.